Hi, I'm Dr. Alan Widener from MassageChairRelief.com, and today we're going to talk about a part of the body called the SacroIliac joint, or the SI joint. Now, I'm a chiropractor by trade, and we work on the SI joint a lot as chiropractors. Like, if you've ever been to a chiropractor and they put you in that side posture and they put their hand on at the base of your back and kind of pop you, that's usually the SI joint, and the joint where the lumbar spine, your low back spine, joins the SI joint. And so the sacrum is a triangular bone at the bottom of the spine, and it kind of starts here and goes down in a triangle towards the tailbone. And it's called the SacroIliac because the sacrum joins the iliac crests, which are these two big bones that make up the biggest part of your hips. And that joint where this iliac crest joins the sacrum is called the SacroIliac joint. And that is a key component to treating low back pain. When I was a chiropractor, man, we adjusted the SI, we call the SI joint all the time. Well, how can a massage chair help the SI joint? Because I have seen it help. It doesn't adjust you like a chiropractor, but why would it help with issues regarding the SI joint? And by the way, the SI joint can play a role in sciatica issues where the nerves, when you have pain going down your legs and whatnot from neurological compromise. Well, how does a massage chair help an SI joint? It doesn't pop the joint like a chiropractor can with a manipulation or an adjustment, but what it can do is it's still there's not much movement in the SI joint. It's a very, very tight joint. It's not like the neck where these bones can pop real easy. The SI joint's a tough, thick joint, and there's lots of bones down there. I mean, look at the butt muscles. The butt muscles are big muscles, and for some of us are bigger than others. And those muscles, they kind of anchor that whole area. And so it's not so much that the roller track, and by the way, for the SI joint, L track and S track chairs can hit the SI joint. L tracks will go down underneath and hit the belly of the glutes, but an S track, a regular S track chair that ends here, will still hit some of the muscles that articulate or help move the SI joint. So when you're sitting in a massage chair and those rollers come down under your butt or underneath your tailbone, it is digging into the muscles that attach to the SI joint. You understand that muscles begin and end somewhere. Their origination point and their insertion point. And there are a lot of muscles that originate right here around that SI joint, like the glutes, like the piriformis muscles. There's some other ones, of course, I haven't been in school for decades, and I can't remember them all, but those muscles are the things that are being affected by the rollers. And when the rollers affect muscles and break up scar tissue and relax muscle spasm in the muscles, those muscles relax, and it relaxes the joints to which for which those muscles move. So you've got an SI joint, even though the motions are slight. If you're having rollers digging into the muscles that affect the movement of that joint, or the movement of your hip, or the movement of your low back, that SI joint is going to be affected because the muscles around it are being affected in a positive way. I hope that made sense. But SI or sacroiliac joints and their associated musculoskeletal problems can be helped by a massage chair. I hope you found this video helpful. If you did, please feel free to thumbs up, like us on our YouTube channel, and share this video or any of our other videos with your friends and family through your social media platforms. And remember, we have stores, showrooms, and you can come and try out all the massage chairs I talk about in our videos are at the showrooms, and you're welcome to come by and try them out and find out which chair works best for you. I'm Dr. Alan Widener from MassageChairRelief.com, and I will see you again on the next video. Bye-bye.